Does the use of cannabis increase the risk of heart disease? This question has been on the mind of many people since the Journal of the American Heart Association published an article in March of 2024 stating that the use of cannabis on a daily basis increased a person's risk for cardiovascular disease by 25%. Although there are endocannabinoid receptors in every part of the body, including in the heart and the blood vessel, no one is certain what the short-term or even long-term effects of cannabis is on the cardiovascular system. We do know that THC tends to increase the heart rate and CBD tends to lower it, but we have not had any evidence of atherosclerotic changes. In this study, the authors did phone surveys of 434,000 people across the United States and 2 U.S. territories and asked them how much cannabis they had used in the past 30 days. The studies asked, did you use cannabis every day? Did you use it sometimes? Or have you not used it at all in the past 30 days? The second part of the survey was to ask if these people, these respondents, had any history, ever been told by a physician that they had cardiovascular disease. Had they ever had angina? Had they ever had heart attacks? Had they ever had strokes? After doing the study and the statistical analysis, they concluded that there was a 25% increase in the risk of cardiovascular disease in people who use cannabis every day. Now, after looking over the study myself, I found 3 problems with this survey. First off, what's a 30-day survey supposed to show? Yes, I use cannabis every day for the last 30 days, but what if I never used it before? What if I used it every day of my life, but about 2 months ago I quit, so I'm in the never used category? What about if I used it sometimes, but maybe only a few times, and I used to use it a lot? I mean, the 30-day criteria, it just seems fairly random and may not really be applicable to giving good study results. My second concern about this study was that even though they surveyed a lot of people, over 400,000 people, only 2% fell in the category of using cannabis every day for the past 30 days. That seems like a very small number to stretch out to say, aha, that's then going to be valid for the whole general population. However, my most important and the most serious objection to this study result was their statistical analysis based on their data. When I look at the data, as shown here on the video, their data actually shows the opposite of what they were claiming. Instead of it showing that people who smoked cannabis every day had an increased risk of cardiovascular disease, it shows people who did not use the cannabis had the increased risk. For example, on coronary artery disease, angina, those people who used it every day had a 3% risk of having coronary artery disease. Those who used it occasionally had a 2.5% risk. But those who had not used cannabis had a 3.6%. They had a higher incidence. So those who did not use cannabis were more likely to get coronary artery disease or have had coronary artery disease than those who did. And as you can see by the bottom line of the table, when they took into consideration all forms of cardiovascular disease, angina, heart attacks, and strokes, it was people who never used the cannabis were more likely to have these diseases than those who did use it. I am not a statistician. I did not necessarily know how they used these numbers, and they had all sorts of graphs and explanations and how they did statistical analysis, and I guess it goes to prove that you can do anything you want with statistics when you manipulate them enough. Still, I cannot see how they came to the conclusion that it's a 25% increased risk of cardiovascular disease when their own table shows it was decreased in every single category. But that's my response. I suppose in the future, if somebody asks you, does this article show that cannabis increases the risk of heart disease? You can say, no, the study actually shows that using cannabis decreases your risk of heart disease. This is Dr. Philip Levin. Please like my videos and subscribe. Thank you.